Our modern diets are full of products we'd be surprised actually contain oil. So when it comes to your food, where does oil start and where does it end? It turns out the line is surprisingly blurry. And the story of how oil ended up on our plates is an unexpected one. It all started in the late 1800s and early 1900s, when the modern oil industry began with petroleum drilling in places like Pennsylvania, Russia, and the Middle East, as crude oil refining produced fuels like kerosene and gasoline. Chemists noticed there was a lot of leftover material, aka chemical byproducts. What could they do with all this stuff? Well, they found they could turn those byproducts into synthetic chemicals, solvents, and even early pharmaceuticals. Suddenly, there was a lucrative market to turn all this black gold into pills, potions, and powders. And then there was John D. Rockefeller, who built his empire on refining petroleum. By the late 19th century, his company, Standard Oil, dominated the market. But as the fuel markets matured, he and other rich industrialists had to think about what else to do with all that oil. And so they invested heavily in chemical manufacturing companies, which in turn funded the first wave of petrochemical-based drugs. This funding also heavily influenced medical education, pushing it away from more herbal and natural forms of healing and towards lab-made pharmaceuticals. A report published in 1910 in the United States called for a complete restructuring of medical schools, which is now known as the Flexner Report, and it basically set the standard for medical education for the next half-century. It promoted the teaching of medicine based on lab research rather than clinical experience, and it helped establish petrochemicals as a central component of modern medicine. By the 1920s and 30s, oil-derived chemicals were the base for many common medicines. That includes aspirin-like compounds called acetylsalicylic acid, which was originally made from coal tar, a petroleum cousin. It was also the basis for anesthetics like ether and chloroform. And for some time, doctors even used oil directly as a painkiller. Oil also became the foundation for certain synthetic vitamins, especially A, D, and E, which were made using oil-derived chemical precursors. And finally, oil enabled mass production of antibiotics. While not strictly speaking petrochemicals, the methods used to make them often relied on solvents like acetone and chloroform, which are petroleum-based. These developments meant that medicines were now more consistent in their dosage, but they also tied medicine to oil supply